Hello, class. My name is Damien. I'm excited to be talking to you about this conversation, and it's going to be about caring. The last time I tried to make this video, it was too long, so I'm just going to get straight to the point. So, caring is described in the Merriam-Webster dictionary as feeling/showing concern for or kindness to others. So, in my own, definition, it's just loving that person. And us as nurses, um, we are called to love our patients, to love each other that you're working with, whether that's nurses or doctors or any kind of staff. And I found a very interesting journal article from International Journal for Human Caring 2020 out of Nevada State College. And found many different things about caring, different aspects about caring. So I'd like to share some of those. You have to pay attention to care. It's universal. So we see this all over the world of this act of caring for people. The timing, there's certain times when it's best to show caring. And let's not lie, it's difficult at times. We have a lot of obstacles. I know for me personally, working in the emergency department, you can start to develop apathy, which is essentially just kind of becoming numb to it, becoming numb to grief and loss and pain and suffering. And it can be through simple expressions. You can show somebody you care about them by giving them another blanket or giving them something to drink or just listening there and talking to them and just being present with them. You have to earn trust and honesty. That comes with caring. Caring is not just a physiological means as a nurse, but also is psychological. It's spiritual, it's emotional, it's mental. Caring reaches out to all of these realms. You have to care about all these things for our patients to give them the best patient outcome. It's the foundation. It's the foundation of my belief of all the other core values is caring at the very center of it. And I'd like to point out that there's a difference between empathy and sympathy with caring. Sympathy is just feeling sorry for that person. Empathy is putting yourself in their shoes. I heard it described as if somebody's in the ditch, you go and sit with them. And you bear that grief with them. And that is empathy. And that's what we should give to our patients. I think of a couple verses that come to mind. Love one another as I have loved you, which Jesus says. And also the greatest among you is a servant. So we can put away our baggage. We can put away anything that gets in the way of us caring for our patients and caring for one another. So I just encourage you to just care, just genuinely care for people and be there and be present and listen and to love people. And I believe that it will help our practice and our profession grow, and we will succeed in having better patient outcomes when they're in the hospital and when they're out of the hospital. Thank you.